Hello and welcome to this week's edition of Health Talk. I'm Zama Buthelezi, and today we focus on childhood immunization. Yearly Africa Vaccination Week is celebrated from the 19th to the 25th of April, and World Immunization Week is celebrated from the 24th to the 30th of April. The aim of these is to promote the use of vaccines to protect people of all ages against disease. Immunization saves millions of lives every year and is widely recognized as one of the world's most successful health interventions. Yet there is still nearly 20 million children in the world today who are not getting the vaccines they need, and many miss out on vital vaccines during adolescence, adulthood, and into old age. So what's coming up on the program? We listen to a nurse I spoke to about the importance of childhood vaccines. Thereafter, we speak to Deputy Director for the expanded program on immunization, child, youth, and school health from the National Department of Health about the impact on children and the health system if vaccinations of children are not maintained. We then listen to the World Health Organization's Director General's warning about what happens when the vaccination coverage goes down. We then speak to the President of Doctors Without Borders, Southern Africa, about challenges faced by the continent when it comes to childhood vaccines. And finally, we will get advice from our regular doctor on the program to answer questions about COVID-19 raised by patients on social media. But for now, let's take a look at the latest South African COVID-19 numbers. While active cases remain stable over the last week, experts fear gatherings and traveling using public transport over the long weekend might lead to an increase in infections. Globally, more than 141 million positive cases have been reported. More than 80 million people have recovered, but sadly, more than 3 million people succumbed to COVID-19 related illnesses. South Africa is still leading with infections in the continent. So just an update on the vaccine front. Last week, Minister of Health Dr. Mullen Mckay announced the temporary pause of the COVID-19 Johnson & Johnson vaccine rollout. This follows a recommendation from the Centers of Disease Control and Prevention and the United States Food and Drug Administration, where 6 women reported a rare type of blood clot 6 to 13 days after the Johnson & Johnson vaccine was administered. This week, South Africa's health regulator recommended that the government lift the pause on administering drug maker Johnson & Johnson COVID-19 vaccines, given that certain conditions are met, and these conditions include, but are not limited to, strengthened screening and monitoring of participants who are at high risk of blood clotting disorder. But for now, let's take a look at the national COVID-19 statistics. To date, more than 10.4 million COVID-19 tests have been processed in South Africa. The country has recorded more than 1.5 million positive cases. A 95% recovery rate has been recorded, bringing the numbers to more than 1.4 million people. But regrettably, more than 53,000 people have died from COVID-19 related illnesses, and we send our sincere condolences to their families. While we are seeing a 95% recovery rate, 4 provinces with big metros continue to record the highest numbers of COVID-19 infections a year later, as well as new infections and deaths. Let's take a look at the infection numbers recorded in the big provinces to date. Gauteng is still leading with more than 420,000 positive cases recorded to date, followed by KwaZulu-Natal with more than 336,000 positive cases recorded, At number 3 is the Western Cape with more than 285,000 positive cases recorded, and the Eastern Cape is on the 4th spot, approaching the 200,000 mark with more than 195,000 positive cases recorded. The following provinces were recording the lowest numbers, but these increased sharply by the end of year 2020 during the festive season. But for now, let's take a look at the total infection numbers recorded by these provinces a year later. More than 86,000 positive cases have been recorded in the Free State. The province has reported a surge in positive cases this week according to the NICD. More than 77,000 positive cases have been recorded in Mpumalanga. More than 66,000 positive cases have been recorded in the Northwest. This province has also recorded a surge in positive cases this week according to the NICD. More than 63,000 positive cases have been recorded in Limpopo. More than 38,000 positive cases have been recorded in the Northern Cape. This province has also reported a surge in positive cases this week according to the NICD. So despite COVID-19 data showing a relatively stable rate of infection a week after, it's actually 2 weeks after Easter break, some experts have warned that the third wave of COVID-19 infections is looming in South Africa, and human behavior is what will determine whether South Africa gets the next wave. That's the fourth and the third. This will also determine their severity. We are all still urged to continue to take precautionary measures, and these include regularly washing our hands with soap and water, sanitize using sanitizers containing 70% alcohol content. Another important factor, we must all continue to wear a cloth mask that covers both our nose and mouth in public. We must all continue to practice social distancing and ensure proper ventilation indoors. If you believe there is a chance you may be infected with the virus, call ahead to seek medical help from your healthcare provider or use the public hotline. Their number is 0800 029 999 and alert them to your symptoms. Remember to protect yourself and protect others. So those are the statistics, but do remember that as we observe and report on COVID-19 cases, the numbers can change, sometimes significantly. We've seen over the last weeks. Remember, you can also be part of the show by asking our guests some of the questions on your mind, or you could simply share your views on what we are discussing. The number to call is 011 714 5861 or 5877. You can also share your thoughts with us on social media via Twitter using @SABC Health Talk or on our Facebook page, SABC Health Talk. Health Talk continues right after the break. Please stay with us. Childhood immunizations help to strengthen your child's immune system to fight many diseases and is available for free at state clinics, with the first vaccine given at birth. But for many parents and guardians continue to deprive children of these life-saving vaccines. I sat with Sister Precious Mkandla from Discoverers Community Health Center in Gauteng, West Rand, to talk about the importance of these childhood vaccines and the impact of delaying or not vaccinating children. Let's listen to the interview. And then with this one, we sat down with Sister Precious Mkandla from Discoverers Community Health Center in Gauteng, West Rand, who explained to us what childhood vaccines are out there and what's their importance.
With vaccines, we have vaccines from birth up until 12 years of age, according to the national guidelines. We make sure that when immunize the babies to prevent them from contracting any childhood illnesses that we encounter, like the polios. For example, with polio, if a child doesn't get polio vaccine, they are more susceptible to getting infected with poliomyelitis. So with that condition, it means there will be deformity of bone formation, which in turn has after effects, long-term effects, because you can't reverse it. It's an irreversible condition. So when we're giving immunizations, at birth we give the polio drops and the BCG vaccine. The BCG vaccine prevents the children from contracting any tuberculosis, which is TB, and then the polio drops, they aid in prevention of the polio infection.
But what is the impact of not vaccinating children?
There is so many disadvantages, if I can put it, of not vaccinating children. Others, they contract diseases, like there are other diseases like measles. If a child doesn't get vaccinated for the measles, they might get it at a later stage in life, and when that happens, other children on the surrounding areas, they contract it too. It's a contagious condition. So that is why we're trying. Our motto is prevention is better than cure. So it is very important that the mothers make it a point not to miss any vaccinations for the children.
Why should children vaccinate against mild diseases like chickenpox?
It is of essence for children to vaccinate for any conditions, as well as chickenpox, the mild conditions. It is because they spread easily, and when they come and to an immune system that is already low, then it aggravates the condition into another level, which is not manageable. We are trying to prevent complications and worsening conditions.
What is the impact of disrupting life-saving childhood immunization?
With the disruptions and coming late for the vaccinations, there are certain medications that they might not get because there is a specific timeline that is given. Like for example, with the rotavirus vaccine, it's just drops that we give. We give it up until 24 weeks of birth. So if someone comes 7 months or 8 months after delivery, they cannot get that vaccine. It means the child is deprived of something that would have helped, because the rotavirus is to prevent the chronic diarrhea. Yes, we're not saying that it will just stop it, but it prevents or reduces the chronic diarrhea in children. So it's very important that all the babies come on time so that they can get a fixed dose of all the important vaccines, because they are very wide in range. However, all of them serve a different purpose.
How have COVID-19 impacted child immunizations, especially during different lockdown stages?
The parents felt that some were skeptical of coming into the clinic. They never came, so we had to make sure we do campaigns so that we educate them that they still must come so that they get the services, because it is very important to immunize the children.
Can parents and guardians whose children missed out on vaccinations still be given an opportunity to vaccinate?
The parents are always welcome. Our doors are open. We work from 7 a.m. till 4 p.m. So it is very important that they come and vaccinate their children so that they can get the best of care for the children to avoid and minimize any complications or childhood illnesses that are there.
Zama Buthelezi for Health Talk at SABC. Well, after the break, we speak to Elizabeth Massetti, who is the Deputy Director of the Expanded Program on Immunization, Child, Youth and School Health from the National Department of Health about childhood immunizations. Please stay tuned. During the COVID-19 pandemic, fear of contracting the virus saw many parents and guardians not taking their children to primary health care centers for the life-saving vaccinations. And experts say this will have a huge impact on the children and the health system in future. As the continent commemorates African Vaccination Week and World Immunization Week, Health Talk puts a spotlight on why it is important that parents be made aware that it is vital that routine vaccinations of children is maintained. Let's welcome Elizabeth Massetti, who is the Deputy Director for the Expanded Program on Immunization, Child, Youth and School Health from the National Department of Health. Elizabeth, good morning and welcome to Health Talk.
Good morning, Azama and the viewers at home.
Elizabeth, I'm sure you heard the interview I had with the nurse. Talk to us about the value of these vaccines for the benefit of parents and guardians.
Okay, they are very, very much available because if you can look at the history of pre-vaccination, more than 1 million of people were dying through the diseases which the vaccines were not yet there. But since now we've got a lot of vaccines, like we've got about more than 20 vaccines which prevents various diseases. So we have seen the mortality rate or the death rate being declined due to the vaccination program. So it's very important, it is very valuable. And also when you look at the cost, it also having an indirect beneficial cost because when you are sick, you cannot go to work and there will also be, your income will also be affected. So by having vaccination is very important and critical so that we keep on living in a healthy way in all your aspects, including your social, your psychological, your financial, because vaccination has also been proved to have a better cognitive improvement in children.
Elizabeth, I just want to, for the benefit of parents and guardians, are these vaccines free, all of them?
All the vaccines are free under the public health sector. But there are vaccines which parents will be expected to pay when they visit the private health sector. But in the public health sector, all vaccines are free.
Let's just put the parents and the guardians at ease. I know because of COVID, many, including myself, we became very skeptical of going to health centers, be it private or public, because we feared contracting COVID. Are there measures put in place to make sure that children, parents, and guardians are safe at these facilities?
Yes, thank you for that question. As you know, since the pandemic last year in March, health facilities have been very, very strict on adhering to the infection control measures. So it is one of the important practice which health facilities are doing now. Hence, we are saying that parents or anyone should not have a fear to visit a health facility if the person needs to get vaccination, because you have to weigh between the risk and the benefits. So when you weigh the risk and the benefits, you'll find that vaccination is more beneficial than the risk that you are looking at. And it's not that you are going to get COVID when you visit the health facility, because those places are adhering or complying to the infection control measures.
Talk to us about the myths around vaccines. I know that because of cultural reasons and sometimes religious reasons, you find parents who are saying, I'm not comfortable with vaccines. And yet we have learned that measles, for one, they are very contagious. Talk to us about these myths around vaccines and how they impact on children, because once a child has measles, they can infect the whole school.
Yes, that is true in that if some few myths which I can state now, especially with regard to personal or religious, something like that, is that people think that you have to use your natural immunity. So you don't need to have vaccine to help you to build your immunity. And that is not true, because if you look at the immunity, you'll find that at some stage, those cells which are building your immunity, they wane or they fade at a later stage, and they will need a vaccination to keep them on. So it is very, very important not to rely on your own immunity, because with your own immunity, it may be less effective than the vaccine. The vaccines make sure that your immunity is being built and being strong to fight against the infections. And as you are saying, when you look at religious aspect of it, I remember in 2017 we had a measles outbreak in the country, and it started in one province and it went to another province. And when we checked, we found that children, the initial cases of measles were children whose parents were against vaccinations because of religious beliefs. But since then, we have tried to address that with the seniors of that particular religious groups, and then the children were vaccinated.
Elizabeth, when you go through social media, there is just too many myths when it comes to vaccines. We've seen it with the COVID-19 vaccine, which is ravaging the whole world. How safe are these vaccines? We saw Johnson & Johnson vaccine being paused last week. How safe are these childhood vaccines?
You know, what I can say is that there is no vaccine, there is no medication which is 100% effective, okay? So let's start it there. So what is happening is that there will just be a rare, very rare events which will happen out of a vaccination. And some of the people, they will mistake the side effects with the adverse events. The side effects is telling us, when you've got side effects, is telling us that your immune system is working, is trying to comply with the vaccine. So the immune system is being built. So that's why you've got those smaller side effects. But with the adverse events, those are very rare. And the safety of the vaccine, remember when the manufacturer is developing a vaccine, there are also critical steps which the manufacturer is undergoing to make that the vaccine is safe. And the minute, because in South Africa we haven't developed any vaccine. We normally get our vaccines from outside the country. Before the vaccines can be registered in the country, we've got SAPRA, which is also looking at the safety of the vaccines, if it will be approved or what. Then the minute the SAPRA, which is the regulatory body for vaccine safety, the minute they see that the vaccine is safe, then they can register it. And that is not the end. We've got another regulatory system. For instance, when the vaccine, like the current vaccine that we are using under the expanded program on immunizations, which are not new, they are already registered. When they are finished, we order new vaccines to come into the country, let's say measles vaccines. Before it can be used, it will go to the national national NCL, the National Laboratory in Bloemfontein, where it will be tested. They will do quality tests for each batch to see that if it is safe. Then if they're satisfied, if it has met all the standards and the criteria of safety from the NCL lab, then is when then it will be released to the provinces for the people to get that vaccination.
Elizabeth, looking at the services that go hand in hand with vaccinations for children, I'm talking vitamin A supplementation, deworming, growth monitoring, and HIV services. Is there currently a legal requirement to vaccinate your child if you live in South Africa?
Currently, there is no legal requirement. As you know, that everybody is being protected by the constitution of this country. But it is very, very important because remember, if you don't vaccinate your child or you don't vaccinate yourself, you are putting a risk to other people around you and even in the communities. Hence, we are saying whether wherever you are, whether you are at school, your child is at public school or private school, or you are homeschooling, it's very important for your children to be vaccinated so that they can protect themselves and they can also protect others around them. It's what now when they're protecting others around them is what we call population immunity.
Elizabeth, before COVID-19, vaccinations in South Africa were not ideal. We used to go to clinics and be told we don't have these vaccines, we don't have this. Talk to us about the parents who have missed out on these life-saving vaccines. Are there plans by government to make sure that these children do not miss out?
Yes, we do have plans. We had plans even before, which we call it a catch-up plan, to make sure that all children who missed any eligible vaccines, they are being vaccinated when they visit a health facility. And during the COVID-19 pandemic, because we all know that the pandemic had a negative impact on all the routine services, including immunization program. So what we have done last year is that all provinces were embarked on the catch-up drive. The intensification of catch-up drive, just to intensify it started in November last year. But remember that the catch-up vaccination has been there a long time ago, and it is even we even supported the provinces by making sure that they have all the resources. And our vaccine manufacturers who are manufacturing the EPI, the expanded program on immunization vaccines, they are also supporting this catch-up drive. They are doing a very great job by making sure that the demand creation is there in the communities to make sure that children are being brought to the facilities or to the outreach services if they cannot go to the facilities or to the schools so that they are being vaccinated.
Elizabeth, I still have so many questions, but sorry, we're running out of time. Thank you so much for the interview, and we will try and have you back because this is one very important subject. Thank you so much. We'll talk to you soon.
Thank you so much. Bye.
Let's take a short break. We'll come back right after this. A few months ago, the World Health Organization warned that children across the world will die as the coronavirus pandemic forces some countries to temporarily halt vaccinations for other deadly diseases. WHO Director General Dr. Tedros said that when vaccination coverage goes down, more outbreaks will occur. Let's listen to his concerns.
WHO is deeply concerned about the impact the pandemic will have on other health services, especially for children. Children may be at relatively low risk from severe disease and death from COVID-19, but can be at high risk from other diseases that can be prevented with vaccines. This week is World Immunization Week. Immunization is one of the greatest success stories in the history of global health. More than 20 diseases can be prevented with vaccines. Every year, more than 116 million infants are vaccinated, or 86% of all children born globally. But there are still more than 13 million children around the world who miss out on vaccination. We know that the number will increase because of COVID-19. Already, polio vaccination campaigns have been put on hold, and in some countries, routine immunization services are being scaled back or shut down. With the start of the Southern Hemisphere flu season, it's vital that everyone gets their seasonal flu vaccine. Even when services are operating, some parents and caregivers are avoiding taking their children to be vaccinated because of concerns about COVID-19. And myth and information about vaccines are adding fuel to the fire, putting vulnerable people at risk. When vaccination coverage goes down, more outbreaks will occur, including of life-threatening diseases like measles and polio. Gavi, the Vaccine Alliance, has estimated that at least 21 low- and middle-income countries are already reporting vaccine shortages as a result of border closures and disruptions to travel. So far, 14 vaccination campaigns supported by the Gavi against polio, measles, cholera, human papillomavirus, yellow fever, and meningitis have been postponed, which would have immunized more than 13 million people.
When routine vaccination programs can no longer be guaranteed, diseases that were previously eradicated reappear, and this happens at the time when little or no medical care is available for the outbreak's victims. The collapse of public health systems due to conflict is one of the major reasons for the epidemics breaking out. To talk about challenges faced by the continent when it comes to childhood vaccines, let's welcome Agnes Musonda, the president of the Doctors Without Borders Southern Africa. Agnes, welcome to Health Talk. Thank you so much for coming through.
Thank you so much for having me. I look forward to this discussion.
Agnes, last year alone, it was reported that 117 million children may miss out on receiving these life-saving vaccines. And COVID was not assisting because of the restrictions and the border closures. As Doctors Without Borders, just give us a brief picture of what has been happening on the ground.
Yeah, what has been happening on the ground in terms of vaccination is, first of all, Doctors Without Borders acknowledges what WHO has stated in terms of suspension of routine vaccination. Announcement was made in March 23. But though WHO stated that this should still continue, this has led to a number of countries, I think about 24 of them, suspending these vaccinations, therefore affecting close to about 117 million children. So what Doctors Without Borders is doing concerning this is that it's still working actively to ensure that the implementation of routine vaccination takes place amid COVID pandemic, because it has been well documented that, for example, one of the routine vaccinations we do against measles is that measles is 10 times more contagious than COVID-19 itself. So amidst the COVID pandemic, we are working flat out to ensure that vaccinations still are ongoing and working within those stated structures.
Besides COVID-19, Agnes, there has been challenges in accessing vaccines, like your pricing. What other challenges are there? And do you think enough is being done, especially in the continent, to make sure that children have access to these vaccines?
Yes, I think the main challenges which are out there are structural. Structure in terms of the systems which are existing there. Sometimes find that the geographical position of the health centers, the conflict situations of where the health needs are still existent. And so those challenges are still there. But what we are doing as Doctors Without Borders is to ensure that we are in those situations or contexts where the public health needs are required, and we are working within those contexts and providing the necessary health needs. If we have to zero down to vaccination itself, I'll give an example of the measles vaccine, which is happening, vaccination program, which is happening in DRC. And we do understand the context in which DRC is in terms of the structures. But we are working, and DRC has faced, I think, one of the biggest measles outbreak in the last 2 years. And looking at the current situation which we are in within the COVID pandemic, we are seeing that these measles cases are still on the rise. But we are there working and ensuring that the routine vaccination services are working. So most of these challenges which are facing within the continent, basically structural, and we as Doctors Without Borders are there to support the health services and provide and address the public health needs. And when it comes to vaccination, we are working tirelessly, like I have an example of the measles project in DRC.
Agnes, I was talking to someone from the Department of Health just now, Elizabeth, and I asked her about the issues when it comes to religious and cultural barriers that have seen many children not accessing the life-saving vaccines. As Doctors Without Borders being on the ground, are you facing the same challenges when it comes to vaccinating children?
Yes. So apart from the structural challenges, we have to look at the community itself. And in the community, there are so many myths and misconceptions concerning when it comes to the medical field. And when we are zeroing in on vaccination, I think some of them are bordering on, as you have rightly said, in terms of religion, in terms of culture, where you find others based on their religion, they don't believe in accessing or having another form of either a weaker version of a germ inserted in their body. They're against that. And then others have cultural misconception as well regarding the perception of health services being provided. So these are some of the challenges which we are also, the healthcare workers are actually facing on the ground. Religious issues, as well as understanding what really this vaccination is all about. So what we are doing is that we have created awareness program working with a health promotion unit to ensure that these myths and misconceptions are addressed. And of course, they are supposed to be translated into the local languages so that people are able to easily understand. And we have created an environment where people can actually access this information, talk to our health workers, talk to the field workers, and so that they're able to address any myths and misconceptions they have around vaccination. But these are very common and they are real, and we are working tirelessly to ensure that they are addressed.
Agnes Musonda, thank you so much for the interview. I wish we had more time, but we do have your contacts. Hope to speak to you very soon. Thank you so much.
Oh, you're most welcome anytime. Thank you so much for having me.
After the break, we get some of your COVID-19 questions answered. Many people have resorted to social media for help in managing the symptoms and a lot of times not getting sound advice. One of our regular GPs takes on some of those questions right after this. Please stay with us. As most countries across the world continue to roll out vaccination programs and still no cure for the virus, those affected and self-isolating continue to suffer from different symptoms of the virus. Chest pains, painful joints, sore throats are among the top symptoms that COVID patients isolating at home are struggling with. With no access to healthcare, thousands of these patients have resorted to social media to share their frustrations and also get medical advice. General practitioner Dr. Mullen Mckay is our guest to advise our Health Talk viewers affected by the pandemic. Dr. Mckay, good morning and welcome to Health Talk.
Good morning, Zama. Thank you. Thanks for having me again.
Thank you so much. Let's just go straight to our first person here. Hi, everyone. I tested positive back in July, or maybe it was June. My brain is foggy. I only became better in December, but I think I have it again. Chest pains, sore, buzzing ear, cough, tight chest, high temperature. My 4-year-old has been battling a fever since Saturday and is now coughing, no appetite. Now today, I watch my 9-year-old go from fine at 2 p.m. to flu-y by bedtime. I'm almost in tears now. Dr. Mckay, do people just get COVID rapidly like that? Does it come back?
Yes, absolutely. We're all at risk. I mean, there's a lot of cases of reinfections after you've had a COVID infection last year. So if they've had it last year, it's a significant amount of time. The antibodies most likely would have worn off by now. And so the person is susceptible again to getting a new infection. And the way it's spreading like that so quickly amongst the kids, it's highly likely that it could well be COVID. Look, we don't really have much flu or influenza at the moment. And the colds are much milder, just a cough, sore throat, and a bit of a runny nose, you don't really feel ill. But if they're feeling as severely ill like that, I would strongly suggest for them to be tested for COVID urgently.
But for children, those mild symptoms, do you think it's COVID or is it something that they can just go and get something over the counter?
Yeah, so that's a good question. It's the way it's been contagious like that in the family, it is most likely COVID. The good news with kids is that their infections are a lot milder. They can range from being asymptomatic, no symptoms, to very mild symptoms. They generally don't get that ill. They never land up in hospital per se. So, but for academic purposes and for the purpose of protection of those around, especially if they are school going, it's important to document whether they have COVID or not. So I would still suggest a test.
Okay. Melanin says, hi, I had COVID back in January. I have been okay, but a month ago, I started getting this symptom. I don't know if it's post-COVID symptoms or what, but I feel like something is strangling around my heart, like my heart is being squashed. It's so painful and uncomfortable. I'm not sure if I can make sense. Please help.
No, that makes perfect sense, Amma. You know, we see a lot of patients who have had COVID as recently as January, February, who present with this type of constricting chest pain. And we know that the SARS-CoV-2 virus has a major effect on heart and on the heart muscle. In particular, can cause fluid around the heart, can cause inflammation of the membrane around the heart, can cause inflammation of the heart muscle itself. So with that degree of pain, please go to your nearest healthcare center, whether it's your GP or a specialist center or a hospital. You will need special investigation to ascertain whether you in fact have a condition of the heart. And in the meantime, please don't exercise, don't go to gym, don't do any sort of strenuous work or exercise until we know exactly what's going on with the heart.
Dr. Mckay, Leonie says anybody that is still dependent on oxygen 2 months after being discharged from hospital. Are you seeing a lot of those?
Yes, absolutely. So it depends on how severe the initial COVID infection was, and what type of, do they just need hyponasal oxygen? Do they need more severe intervention? And of course, it depends on how much damage, as it were, was done to the lungs. And those where there was fibrosis, more severe complications, they tend to be on oxygen for a significant period of time. So 2 months is still within the ballpark, may even go on longer. And we just trust and hope that the lungs will slowly improve so that we can use less and less oxygen. But that's par for the course for a severe COVID infection.
Patty says, I tested positive for COVID-19 on the 25th of December. I've since recovered and tested negative in January. However, I think I'm still suffering from the after effects or long COVID because I still have difficulty breathing, sweating, fever-like symptoms, insomnia, etc. How long do these last, Dr. Mckay?
Yeah, so that's a critical question. And the short answer, Zama, is that we just don't know. There is a lot of research going on, but we don't have any clarity. And of course, there's lots of variability between different patients. So where one with maybe 6 weeks to 3 months, we are now seeing cases over 6 months, going even on for a year. So unfortunately, the advice is just be patient. It should settle, but we have absolutely no idea of how long. It can vary from patient to patient. So it's a very difficult question to answer.
We have Zine, Dr. Mckay, who says, I have this thing like mucus stuck in my throat and I'm experiencing shortness of breath at night. It's my 3rd month post-COVID. What can she do, Dr. Mckay?
I would suggest that she carry on with the steaming. Steaming is very important, and especially after you steam, try and blow the nose. You may benefit from a cortisone-based nasal spray, which is also helping, and then an antihistamine. Preferably, Zama, not those available over the counter because they are not indicated for long-term use. So cortisone-based nasal spray, continue with the steaming, and that the pill ACC that thins the mucus may also help as well.
Dr. Mckay, thank you so much for talking to us. It's goodbye for now. We'll talk to you again next week.
Thank you, Zama. Bye-bye.
Thank you to our guests and our viewers for watching Health Talk. Don't forget, the only way to manage this pandemic is if we all play safe and protect each other. Stay at home, social distance, wash your hands, and wear a mask outdoors. I'm Zama Butelezi. Do take care.
On Stories